Welcome, everyone. Thank you for joining our webinar today. Our webinar today is the Action Alliance Framework for Successful Messaging, a primer for state suicide prevention coordinators. This event is co-sponsored by the Suicide Prevention Resource Center and the National Action Alliance for Suicide Prevention. Thanks so much to you who've shared some of your successes and challenges before we got started today. It was really interesting to see that everyone had a very unique success or challenge, so hopefully we'll be able to address some of these, and it will be applicable throughout the webinar how we can talk more about these successes and challenges that you all have had. So before we get started, I just want to turn it over to Zoe Baptista to go over the technology that we have with us today.
Hi, everybody. I just wanted to say quickly, if you're having any technical problems, please call SPRC at 617-618-2984 if you can't connect, or you can call Adobe Connect at 1-800-422-3623. Those numbers will be on your screen, and they're also in the invitations that were sent out. All participants will be muted for the duration of the webinar, so if you have any questions at any time, you can type into the Q&A box at the bottom of your screen. You just type into that little bar right above where it says everyone and hit return. And then finally, you can make your presentation screen larger at any time by clicking on the full screen button, which are the 4 arrows that are pointing in different directions in the upper right-hand corner, and it will make the presentation larger, and you can click on it again and it will make it smaller. Carrie, back to you.
Great, thanks, Zoe. So here's who you'll hear from today. My name is Carrie Smith. I'm a Senior Prevention Specialist here at the Suicide Prevention Resource Center. I'm thrilled to be joined by Linda Langford, Evaluation and Communications Scientist here at the Suicide Prevention Resource Center, and Jane Ann Miller, a Public Health Program Consultant at North Carolina Department of Health and Human Services. Linda and Jane are going to introduce themselves a little bit down the road, and let's also talk a little bit about what we're going to be doing today. We're going to go over how messages can fit into an overall suicide prevention strategy, as well as the Action Alliance Framework for Successful Messaging and how those different components can help you in your communications planning. We'll also hear from Jane about how they created a strategic communications campaign in their state, and how some of the challenges she ran up against, the types of solutions she figured out, how those might also assist you in your work. Without further ado, I'm going to turn it over to Linda Langford.
Great, thank you, Carrie. So as Carrie said, whoops, going forward too fast here. As Carrie said, I'm Linda Langford. I work with SPRC and the Action Alliance, and I'm going to get us started today and present for the first maybe third of the webinar, and just give you some background on the Action Alliance framework, kind of what is the rationale for that, and what does the framework look like. And then I'll invite Jane into the conversation, and we'll sort of have a dialogue where I'll give you a little bit more information about some of the principles of the framework, and then she'll talk about how those played out in her state. I'm going to go very quickly through this first series of slides that are really the backdrop to the framework. And what I'd like you to think about is, based on the review that I'm doing, what makes messages more successful? And then I'll ask you to share those. So as all of you know, we care about suicide prevention messaging, and we do because it has the potential to be harmful, to increase risk, and it also has the potential to be unhelpful, to undermine our prevention efforts or sort of fail to support our prevention efforts. And then conversely, it can also promote the behaviors that we want to see, and it can support our prevention goals. So obviously, we want to see more of what's on the right-hand side than on the left-hand side. So the National Action Alliance for Suicide Prevention, which is a national public-private partnership that's working on advancing the national strategy and high-profile priorities of the field across the nation, set 4 initial priorities. And one of those was to change the public conversation around suicide and suicide prevention. And what they were talking about is really this idea of the national narratives, or the overall stories that we're telling about suicide, and to make sure that they are promoting kind of the positive aspects of suicide prevention, to promote hope, to promote help seeking, to encourage resilience, to kind of support our positive goals. That priority is being pursued along two separate pathways. There's some, relationship obviously in the kind of recommendations that go on each pathway. One audience is media and entertainment professionals, sort of along the lines of the media recommendations, and those correspond to National Strategy Goal 4. What we're talking about today is the kind of pathway that looks at public messaging. And what are we, the people who are working in suicide prevention, mental health promotion, other people who are doing suicide prevention, what are we putting out into the public domain about suicide? And that corresponds to National Strategy Goal 2. So that leads to the question, what's public messaging? And so we defined it very broadly. So I was involved with this effort, kind of providing support to this effort, working with a lot of other people on this effort to change the public conversation. And we thought on the public messaging side, as we looked around, that there are campaigns that influence the public perceptions about suicide, but there's also lots of other kind of messaging that aren't kind of the planned campaigns, PSAs, posters, those kinds of materials. They're kind of people's day-to-day tweets and Facebook posts, organizations who are using social media. People are putting out newsletters, they're publicizing events, they have websites, they're doing fundraising, they're creating materials. There's lots of different ways, and all of those contribute to what the public thinks about suicide and suicide prevention. It's equally important to know what we're not including within this. So basically, nothing that's one-on-one, no private conversations. This is not about our messaging when we're intervening with people in crisis. This isn't about, if a person is suicidal, what do I say to them? This is sort of more about information that we're putting out into the public for educational purposes. It's not about clinical interactions. So those are important kinds of communications as well, but they're not what we're talking about here. All of you work in states in a variety of capacities, and I'm going to ask Zoe to switch the view here for a minute. And what are all the ways that you're communicating to the public, thinking broadly about all your messaging efforts? I know some of you are doing campaigns. Those take a variety of forms. Radio, great. Public awareness website, issue papers, good, that's a great one. Yep, that absolutely shapes the public conversation. Statewide social marketing campaign, yep, presentations often are shaping people's perceptions about suicide and suicide prevention. These are great examples. I see that you're all typing, which is great. Many ways over the years, Kentucky says, yep, Facebook, brochures, videos, PSAs, radio, TV, absolutely. And marketing campaigns, training, yep, Facebook and Twitter. So some states have done a lot of social media, other states haven't done as much social media. It depends on how people in your state view that. Good. So you see this broad variety, even just among that quick list, that people are using to communicate to the public. So sort of one takeaway from this that I encourage you to think about is kind of what are all the ways we're communicating to the public about suicide, and kind of what's our messaging look like across those different venues. So you can switch us back. Thank you. So why is there a need for a change in suicide prevention messaging? So you can just read this list of kind of sources that we use to shape our understanding of what was needed. And a little bit later on, I'll show you a point to where you can find a lot of details about what I'm going to present right now. So first, there's research and best practices. We have all of us known for a long time that the don'ts in the media recommendations for journalists also apply to all kinds of messaging, to the messaging that we do. That's a pretty common theme. Looking outside of suicide prevention, there's a good deal of literature on what makes for more effective health communications. And then as we looked around, we also really noticed that there's a lot of guidelines out there. So the one pictured on the right here is the CDC social media toolkit. So obviously that is a great toolkit, whether no matter what the content is. And so some of them aren't specific to suicide, and if you're not using social media, you don't need that toolkit, but if you are, it's a handy guideline to know about. Looking at what is happening in the field, what our expert panel and what other reviews told us is that there's really been an emphasis on problem severity. Kind of that's the main theme, maybe to the expense of other kinds of things we could focus on. Although the safety guidelines are fairly well recognized, a lot of times there's still messages coming out there that do violate the safety guidelines. Often in an effort to kind of bring attention to this really serious problem, we might be creating this kind of overall storyline that is a little bit hopeless. So if you look at these, so these are all legitimate messages to put out there. One is about announcing in a report, one is announcing a full-day event, but we have to ask ourselves, do these make suicide seem preventable to the person who might think that it's not preventable? And then we ask ourselves, well, where are we on this kind of awareness goal? So if you could switch us to the polls, please. So I want you to rate on a scale of 1 to 5 to what extent you agree or disagree with the statement suicide is preventable, with 1 being strongly disagree, and you can click all the way up to 5 being strongly agree. And then what % of Americans do you think agree with the statement suicide is preventable? Is it between 10 and 20%, between 70 and 80%, and between 30 and 40%? So you can click that. People able to click that? You'll see the results on our, after we, in a moment. Just going to give you one more second to reply to those. Okay, so why don't you go ahead and show the results there, both of them. So you can see that, we as suicide prevention people, agree or strongly agree, all of us, that suicide is preventable. If you ask the public this same question that you see up on top, what you get is a range of answers between 70 and 80%, right? So which is very surprising, I think, to a lot of us in the field. And so for in California, in their statewide survey in 2011, 73% agreed or strongly agreed with that statement. Only 11% outright disagreed, and 16% ticked that neutral, that number 3 response. And there's a couple of other surveys, including Kentucky's, who I know is on the phone, that showed very similar results. So the public in the abstract already agrees that suicide is preventable, at least in the abstract. And in public opinion polls, the majority also think that suicide is a problem, think everyone should have a role in suicide, that it's important to invest in suicide prevention. So, we really thought to ourselves, we've done a pretty good job at putting this on the radar screen. And what gets lower number of lower percentages in these polls is knowing how to take action. So you can switch back to the presentation. So I think we should feel great about that, and I think that also kind of takes us to a new place, maybe. So CADNAB is an expression that I created when I was teaching health communication students. It means that it stands for knowledge alone does not alter behavior, and the trademark is sort of a little joke there. So that's an overstatement. In general, though, knowledge alone does not alter behavior. There's some exceptions. If people don't know a crisis line number and you give them a crisis line number, that little bit of knowledge might result in some people calling the crisis line. So it's a little bit of an overstatement, but it's a way of really expressing that just helping educate people about a problem or helping them believe that the problem is serious or terrible doesn't necessarily tell them what to do about it. And so kind of ask ourselves what makes messages more likely to lead to action, and what do we know from the literature makes them more effective. How are we doing on that as a field? And what we found in general is, and again, there's obviously exceptions to this, but a lot of messages have, so research tells us that having specific audiences and very specific and targeted goals is a better practice, and a lot of our messages have very undefined audiences. It's sort of everybody, or our goals are very vague. A call to action, right, a specific action step is a good practice according to the literature, and in our field they're often either absent, there's no call to action at all, or there's something like speak up, reach out. So who is supposed to speak up, and who are they supposed to reach out to, and what are they supposed to say? So the lack of specificity. And so that was sort of summed up the previous polls, and these slides were sort of summed up by one of our expert panel members who said, it's time to shift from communicating for awareness to communicating for action. And related to that, more effective efforts in general are integrated with programmatic efforts. They're part of an overall strategic plan, and they are linked in with the other things that they're doing that are our non-communications efforts. So in this case, there's a nice call to action, see your doctor, but we know that many physicians aren't properly trained in assessing and managing suicide risk. So if we're putting that message out there without a corollary effort to train physicians, then maybe we're doing a disservice. So I'm going to have you switch over again to expand the Q&A box. So based on this review, you tell me what makes for more successful messages. What are some of the things that stuck out to you and what we just went over? Give you a minute to respond there. Need to specify the audience, absolutely. Call to specific action, yep. Messages tied to specific action. A couple of you said that. Clearly defined audience with a specific call to action that's tied to a greater prevention effort. That's a great summary. Yep, specific actions people can take. And that, I think, is a really huge one. I think we do have some things in mind, and we don't want to narrow the actions that we're asking people to do. But in a way, if we just assume they know what the actions are, then we're not necessarily helping them to take that next step. So they have good intentions, but we want to help them act on those intentions. Not everybody knows. So I would also say that, a majority of people are saying suicide is preventable. So it doesn't mean that we disregard. In some cases, we may want to pick an audience that doesn't already believe suicide is preventable for a particular reason, and we want to know what that reason is. So great. So, so here is the framework for successful messaging. And what we decided based on that review was, there's really not just one thing that we need to be thinking about when we're developing messages. Yes, we've known about safety for a long time, but this other thing about a specific audience, specific objectives, a call to action, that strategy piece, we really need to elevate that. That's maybe something we haven't been emphasizing as much. And then the whole kind of philosophy of the Action Alliance around that we have to make sure that we're doing a good job at kind of spreading the positive news out there, right? And I don't mean positive news around suicide itself, trying to put a positive spin on that, but to let people know that suicide is preventable and that there's specific ways that they can do that, or there's specific things that we know about suicide and how to prevent it that we didn't used to. And then finally, to follow whatever applicable guidelines might apply to your particular kind of message. So the suicidepreventionmessaging.org is the short URL that will redirect you to a very long URL. So we encourage you to share this URL because it's easier to remember. So just really briefly, I'll go through each of these components, although I think you probably have a pretty good idea of what's in them. We put strategy at the center because it's really got to be at the heart of all of our messaging, and it shapes all of our other decisions. And so one question is, should we use communications, or should we use communications right now? So one person said, when we asked you what kinds of messaging that you've done, people said, I've done a whole variety over the years. So there's, maybe times where messaging isn't as much of a priority, or you might do different kinds of messaging at different times. So you just want to make sure that, the resources that it consumes, the time that it consumes is really using your resources well. Another issue with strategy is kind of starting in the right place. So the temptation is to sort of start from the delivery channel. We need posters. How are you going to get the message out there? What's the product we want? And instead, what we want to be asking is why? Why are we messaging? And then get to how. So kind of really the two major components of strategy are systematic planning and following best practice principles. So this is the planning element. On the left is a great little circular strategy diagram from the great guide, Making Health Communication Programs Work. It's put out by the National Cancer Institute, but it's a fantastic resource and very applicable to lots of different areas. So that starts with that planning and strategy development, and that's what we're recommending as well. And then the kind of key planning steps or decisions are shown here. And I won't go into too much detail on these. This is a lot of information on the website about them. But in short, it's sort of setting the context is about, well, who are we? Who are we as a messenger? What are our programmatic priorities? And then why are we going to message? The who question is audience. The do question is action. What to say is kind of what is the specific thing that we will say to this audience to get them to do that action. Then we get to how to reach them. And the so what is sort of the evaluation question. And then research-based principles of effective communications. We've already talked about a number of these. Of course, we want to be using the published research literature at each phase, tying it to that overall program for change. Audience research and pre-testing is critical. We'll talk more about that. We've already talked about having a specific objectives, audience, and action. Making sure that we put that the content of the message and the framing is really directed towards this audience to build motivation that's meaningful to this audience to take the action that we want or to, kind of come away with the new understanding that we want. Picking the right delivery channels and making sure that the audience is exposed to the message, right? So if we put it out there, but it's not getting to the audience, then it's not going to be effective, and then assessed to the extent possible. So this is the strategy principles, and this is why these two last slides are really at the heart of the framework. The other three framework elements, the safety, the positive narrative, and guidelines, are really woven throughout these principles, and I'll show you a slide in a little bit that kind of has them all blended together. So the safety component, we're all pretty familiar with this already. We don't want messages to be to increase risk or to be unhelpful. So we have the don'ts for public messaging, very similar to the media recommendations, except for we added a couple of more that are really specific to them being unhelpful. So oversimplifying causes is unhelpful to our prevention efforts. It leads people in the wrong direction in understanding clearly what suicide is and how it should be prevented. And then we want to avoid anything that reinforces kind of negative stereotypes, myths, or the prevalence or intractability of stigma. We think those can undermine prevention efforts. The positive narrative element is really figuring out in every message, how do we counter that negative narrative? And the way I like to think of it is, how do we help the public to really envision prevention in a way that makes sense to this message? So it's not a superficial, we just stick the word hope on there, or, have kittens and rainbows and long walks on the beach. It's really to kind of think deeply about what's your strategy and what is a meaningful way to send that, to tell a more positive story about suicide and suicide prevention. And there's lots of ways to do it. Context matters. It's not one size fits all. And so thinking about what fits with your strategy, here's a number of different ways that you could illustrate a positive, or convey a positive narrative. In some cases, there's bad news that's being put out there, and I think we can couple those. So there's a study coming out that shows, and you're asked to comment on a study about something that's not effective. How can we use that as an opportunity to convey what we do know is effective? sort of, so it doesn't mean that we're kind of trying to cover up the negative story, but that we're just always trying to get that positive narrative out there. And finally, we just wanted to have sort of a one-stop shopping for the guidelines and resources that exist that are specific to specific kinds of messages. So we have a pretty short list of those right now, and we're looking to populate that more over time. So the idea here is not to kind of focus on any one or the other, but to really be encouraging to ourselves, use all four lenses when we're developing messages, and to encourage also our partners and stakeholders to be doing the same thing. So the strategy piece is more elaborate when we're doing a campaign. Obviously, you're going to do a more extensive planning process, but I think there's also a way to sort of run through these in a mental checklist to say, I'm doing social media, so how does this fit with my strategy? How do I make this, make sure it's safe? How do I make sure it's conveying some version of a positive narrative? Am I looking at the right guidelines? I think there's kind of, this is a systematic planning process, but it's also a way of thinking. So here's the overview of the principles that kind of weaves in. I've highlighted the other components of the framework. So you see that, throughout, at different points, there's guidelines that might shape your efforts. So you want to be going back to that guidelines page repeatedly to say, is there something that would be helpful to us at this phase? You want to make sure when you're picking your objectives and call to action that you're thinking about, it being kind of positive and proactive and supportive of prevention. The actual message development is, the images and text and sounds are safe and convey a positive narrative, et cetera. So it's sort of, the framework isn't meant to be 4 steps. It's really kind of 4 different ways of looking at your messages. So we're going to pause briefly here, and so I'm going to ask you to blow up that box again. And do you have any questions so far? And then I'm going to invite Jane into the conversation in just a moment. I wanted to make sure people had a chance to ask a question or make a comment at this point. I don't see anybody typing right now. Oh, I do see somebody typing right now. That's great. Okay, it looks like not right now. Oh, here we are. When we present the framework, who do we say is endorsing it, promoting it, et cetera? So I think the best thing to say is to talk about it as being a product of the National Action Alliance for Suicide Prevention, and that is a multi-agency effort, and I'll show you in a little bit where to find background research, and there's a number of organizations that gave input into it. In terms of endorsing it, there's, we didn't ask for formal endorsements, but what we have is a place, and I'll show you this in a screenshot in a little bit. There's a place to sign on. And so there's a number of organizations like AFSP, like a number of state agencies who have kind of signed on to it. And you can sign on to it as individuals if you don't think you can, that you feel like you can do that on behalf of your state agency. So I think you can say people who have signed on are endorsing it, and then I want this to sort of be, or I think we want this to be sort of like the media recommendations, where a number of different individuals and organizations worked on putting them together, but they kind of belong to all of us. And so I hope that we're all promoting it. I hope that answers your question. Smiley face from Inara. Okay, well let's go on then. All right, so I want to take this opportunity now to bring in Jane Ann Miller, who we're delighted is joining us. So Jane, why don't you just introduce yourself?
Thank you. Good afternoon, everyone. In North Carolina, I serve as the project director for our Garrett Lee Smith grants. We were awarded in 2008 and again in 2011, which makes us a cohort 4 and cohort 6 grantee. We're perhaps a little bit different in that our Garrett Lee Smith is housed in our Division of Public Health and not in the Division of Mental Health. However, prior to my work in suicide prevention with the division, I did work on the front lines in community mental health.
Great, thank you. So the format for the rest of this, this session is that this is sort of formulated as a back and forth between Jane and I. So I'm going to talk a little bit more about some of the framework concepts, and then Jane is going to, we're going to alternate. We'll all present just, a slide or maybe 2 slides about some of the concepts, and then Jane will talk about how those look in North Carolina. So I know that this is a grant-funded project, and those of you who haven't been a grantee or are not currently a grantee, I think that can feel discouraging sometimes to people, like, oh, I can't do it, there's something that extensive, and it may be. But I also think that there's a lot more of this kind of thinking that you can do whether or not you have the funds to do particular products or not, because I think that a lot of times that's where resources come in, is kind of the, how much resource, how many channels you can buy, or what kind of design you can buy. So I encourage you to really think about just this process and the thinking that their group did, because I think that that's really what stands out. So, so I said that a more effective communications is tied to an overall program for change. So this shows some of the kinds of broad goals that you might be pursuing, and obviously probably you're pursuing multiple goals. And so so one thing to do is to look at the kinds of broad goals that you're pursuing and to say, how could communications advance that programmatic goal? We're very focused on restricting access to lethal means. So how can communications work in conjunction with the other things that we're doing around means restriction? So that's one way of tying those together. Being realistic about what messaging can and can't do when used alone. So one of the reasons to combine messaging with other programmatic components is that we know it's more effective, and it also increases the likelihood that we're not relying on messaging to make a really dramatic change. And I'll just also say that even if there's other goals that you have around, establishing the legitimacy of yourselves as experts, or letting people know that your organization is a resource and that kind of thing, those other kinds of non-suicide prevention goals, but programmatic goals, communications can also advance those goals as well, using these same principles. So Jane, how did that look in North Carolina?
Well, this is a brief overview of the major goals of our grants. In 2008, we didn't have any capacity to do gatekeeper training, so our first order of business was creation of suicide prevention program trainer cadre, and we had invested in the programs of ASSIST, Safe Talk, Lifelines curriculum, and the Lifelines postvention programs. So once we had established that cadre, we were able to conduct gatekeeper trainings throughout the state, and we focused primarily on specific school service programs. And for example, we have a program in North Carolina called the Child Family Support Teams, which is a combination of a school nurse and a school social worker whose caseload is those high-risk students who are at risk of failure or poor health outcomes. And we also focused gatekeeper training on school-based, school-linked health centers. And then once we had kind of simultaneously to doing those gatekeeper trainings, we began the creative process to develop our website called It's Okay to Ask. But it wasn't until after we had the gatekeepers already in school that we felt more confident and secure in launching our communications campaign targeting the youth audience. We didn't want to have youth receive the message of help seeking without first building a foundation of informed schools. And so our Cohort 6 grant 2011, we continued with our gatekeeper training targeting special populations, and then we're able to continue with our communications campaign. And as I had stated, we had first wanted to form a foundation of gatekeeper trainings in the state prior to proceeding with our It's Okay to Ask website going live. And this map is to illustrate those counties in which we had already conducted trainings prior to the website going live and the communications marketing occurring throughout the state.
Great, thanks, Jane. So what she's describing is kind of both thinking about the focus of communications and also the timing of communications, which I think is very smart. So the next principle that we're going to take a look at a little bit more is this idea of informing your communications with audience research and pretesting. So looking at the published literature is always a good idea. I know all of you do that, but sort of thinking about that in terms of looking at the published literature around your goals and how can communications advance those goals. Sometimes some people have published audience research with certain age groups or around certain kinds of calls to action, and you can learn from that. By local, I mean as in localized to your state. You can collect quantitative data, number data, and also qualitative data. And again, the decisions about these are somewhat strategic and have to do with resources, have to do with the questions you want to answer. But people often find it useful if you don't have the money for a statewide survey to maybe try to do some quantitative data, and then also some focus groups and interviews. And then looking at any guidelines that exist. There are a number of guidelines that tell us what populations use, what audiences use, what kind of social media, and that sort of thing. So a lot of times those can be part of your audience research. And why do you do it? To avoid assuming that you know what's needed, because having designed a number of campaigns in my life now, we don't know what the audience believes. We don't know what makes sense to them. We don't know what behaviors they're willing to do or not willing to do. So what we're really trying to do is to picture those issues from the audience's perspective, to put ourselves in their shoes, and right or wrong, their perceptions are what's driving what they do and don't do. And so we want to know about those. And by getting that more detailed understanding, that's when we can start getting specific about the calls to action and about the content that would be helpful. So Jane, why don't you talk about the audience research that you did?
Well, we had two objectives for the campaign, and we felt that the objectives kind of nested with each other. One was to reduce the stigma of mental illness and increase help-seeking behavior in youth, and that was for both self-identifying that they needed help and also seeking help for peers. And since the means by which youth receive information and communicate has changed tremendously over the years with the technology, we felt we were out of the loop as adults and in a different generation, and we recognized that we wanted to directly ask the youth about how they use the media, what they use, as well as how what they believe about mental illness and suicide, and where they would go to seek help if they should have any sort of issue. And to accomplish that, we formed focus groups across the state. North Carolina is very large, but we tried to get a profile of the diversity of the state by going into urban and rural areas, being able to include racially and ethnically diverse youth. So we came up with about 65 youth within 8 focus groups across the state. And how we conducted the groups was very deliberate in that we had a trained facilitator who was used to working with youth so that they could be supportive listeners and knew how to handle youth feedback. But coupled with that facilitator, we had an assist trainer in the room with them. And that was a safety feature in case any of the discussion might trigger a stressful reaction from one of the participants, that there would be someone there that could provide support. What we discovered from the youth is that their preferred sources of information were text. They like texting each other. They talked about their cell phone usage, admitting that they slept with them. They also said that they used websites to access health information, and they were heavy social media users. Now, at the time that these focus groups took place, MySpace was still fairly popular. Facebook was definitely gaining ground with the older teens. But at the time, Twitter was not popular, and Twitter was viewed by our high school focus groups as being used by old people, meaning those over the age of 20. So they didn't really relate to Twitter, but MySpace and Facebook and Bebo were all mentioned as media that they liked. So we had received support from a broadcasting company to develop what we call test logos for the youth to review and provide their feedback and comments. And what you see, it's okay to ask, is the final product. But this logo had different permutations, different font styles, different colors, different kind of configurations. And as a suicide prevention program, we had no idea that there was research out there that actually looked at colors used on youth-oriented websites, not necessarily suicide-specific websites, but anything pertaining to youth, from fashion to just communication to chat rooms and the like. And the Color Institute looked at the colors that were popularly used on those sites and came up with a color scheme for us to review and the youth to review. Additionally, there's research conducted on the type of fonts used by youth on youth-oriented websites. Again, something that was very new to us. We had no idea of some of these font names, and in fact, I think that one of the fonts used in our logo actually goes by the name of grunge. And of course, none of our program team had ever heard of it, and it certainly is not on our office computers. So it was very beneficial to have a broadcasting company, someone who was an expert in how to research these trends among youth, to create test logos for us to then present to the youth for feedback.
Great, thanks. And I see we have a couple questions, and we're going to just do a couple more slides, and then we'll pause and take those questions and any others that people have. So thanks, Jane. That's a great description of your thinking that went into here's why we're doing our focus groups and who we need to talk to and the kind of research that you did. So how does this kind of research inform decision making? Well, it really helps to get to that specific increase or decrease that you want, and you'll see when Jane shows you their website that the specificity of their goal, they have these broader goals to start with, but that there are very specific objectives, that are being achieved by the website. So that helped them to kind of narrow what the, kind of the way that they were thinking about their objectives. Specifying the audience, and we did have a question about this. In general, communications is more effective when it's targeted to a more specific group, and that's because you want to talk to those people in a way that's meaningful for them, the way that they're sort of processing the issue, and also the behavior that you want them to do. And so if you want, so this is to youth, and you saw that the specificity with which they prefer different kinds of platforms, with which they prefer different kinds of, with which, the media that they're used to has a different look and feel. So if you're trying to reach parents and you're using grunge font, it's maybe that's sort of the con of trying to appeal to everyone is, well, whose preferred look and feel and messages do you pick? So you're going to maybe try to reach everybody, but you might lose some people. I think there is a way, the pros of picking everybody is that sometimes your funding requires it. Sometimes you do that for sort of stakeholder reasons. And I think that if that's more effective if you have a call to action that is really very broad, maybe like calling the lifeline or those kinds of calls to action, and that there's some way of having maybe different strands of the effort that use maybe some different images or different wording or happen in different locations that can reach different segments of the audience so that the framing out of it can be a little bit different. One of the audience decisions is, am I trying to reach the people I'm concerned about directly, or am I trying to reach them indirectly through another audience? So if we want to improve the safety of youth, we can either appeal directly to youth, but we might also appeal to parents. And the call to action to parents would be different because we want them to, watch for the warning signs or speak to their son or daughter, or, so there's that kind of call to action. We might reach them through school personnel. We might reach them through their physicians. So that audience decision also has to do with kind of the strategy of how would I best reach the people who, whose safety I'm concerned about. Formative research also helps you to get to that call to action. What should people do? And again, matching it to the objectives in audience. And then there's a great way of using formative research to really figure out, well, what do I need to say or show or, have in the sound and look and feel of our messages that would help this audience to do this behavior, including wanting to kind of highlight the benefits that they see. So we can always think of why we think they should do a behavior, but what's the benefits that they would perceive of doing the behavior, and how can we lower the barriers that matter to them? And it might be that we lower the barriers not necessarily through messaging, but through our other programmatic efforts. And then those decisions, help shape delivery channels, right? Because depending on your audience and your content and what's the call to action, you might send that out through different kinds of channels for different audiences. So Jane, why don't you talk about some of the decision? Oh, let me just do one more slide. Sorry, I threw this in here. The pre-testing is sort of after you've mocked up your messages or materials, you've kind of gotten to maybe a couple of different messages or materials, and you want to do some pilot testing of those, and you're just asking people, kind of, what do you see here? Does this make sense to you? And so these will be posted, the slides will be posted afterwards, and I put some specific questions on here that are good kind of pre-testing questions. So back to you, Jane.
All right, thank you. As I said before, their preferred sources of information were text, cell phones, websites, and social media. And I'll get into this a little bit more later, but social media was not an option for us in state government at the time. So we explored what type of features they would like on a website. So a website option was available to us in state government, but not social media. So when we explored the features that the youth liked on websites, they liked links built into websites that would connect them directly to additional information. They liked pop-ups. They also liked videos, but they were very clear in stating that in a video they would be able to discern whether or not they were real people or actors. And they would be in tune with the type of clothing, the dialect, as well as the authenticity of the individual. They also wanted links to local resources. Surprisingly, they were interested in statistics and facts, and they would said that they would prefer if there was something on the website where they could enter like a contest to get a prize. And fortunately, we were able to incorporate most all of those features in the website. This is a screenshot of the landing page, and those big red arrows are not on the web page. I superimposed them to illustrate the menu bar where it highlights action steps that the youth can take. So it's just, not a visual, not only a visually appealing site, but it also empowers them, because the youth's feedback to us is that they wanted to be able to know what to do. They didn't want to feel helpless. They wanted to feel empowered. So we put specific pages in the website about the signs and symptoms. We didn't call it signs and symptoms. We wanted it to be a more youth-friendly terminology. What to do instead of action steps, what to do, how to get involved, are all things that would help them become part of the suicide prevention process.
That's great, and that's a great example of using that formative research to figure out how to frame out those calls to action in a way that was meaningful to the audience here. So you see how North Carolina framed their version of the positive narrative here is those calls to action, right? Because having calls to action paints the narrative. There's something that can be done about suicide, so that's automatically a positive narrative. Here's just some other ways to convey a positive narrative, talking about projects that are out there. So this was a tweet one day. New Hampshire Suicide Prevention Project focuses on gun shops. So that might catch somebody's attention and say, oh, hey, I didn't know that was even a possibility. That's a version of the positive narrative. The second one is from a blog, an organizational blog, where a parent somebody who was an employee at this organization who's a parent ended up helping their own child because she went to a suicide prevention training, or he. I don't know if the parent was a she or he, but they told this great story about kind of not thinking that the training applied to them and then being able to use it at home. So it's a great version of a kind of success story. And we also saw that Wyoming shared at the beginning their postcard, I used my training today. Right? So I love the idea of collecting those and feeding those back. Great way to do the positive narrative. Another tweet, a loved one has attempted suicide. Now what? Attempt survivors explain what family approaches put them more at ease. So a lot of times the narrative is families aren't supportive, but here's one saying, here's what's helpful instead of what's not helpful. So it doesn't mean we never say what's not helpful, but that we also are putting those messages out there about what's helpful. The coping skills, I think, was from a Tumblr. It's just a, kind of a little skill building worksheet. The Pinterest is a fundraising appeal. This is, kind of what you get for your funds, like what's the positive work being done for your funds. And then the one at the bottom is real stories of hope and help for veterans, and that's the Make the Connection campaign. Kentucky also talked at the beginning about making a video with school principals that help schools know how to get proactively involved. So I really love that idea too. So those are all great examples of the positive narrative. So we're going to just pause for a minute, and we have Jeff's question. Do you want to read that?
Sure. So Jeff asked the question, when talking to the kids about what social network they liked, were there any concerns about turning them off by having the old people, quote unquote, in suicide prevention sending out messages, or would have been private text to text or email to email been better? So Jane, I believe this is a question for you.
We had found during the focus groups that we held that the youth were very excited that the old people were talking to them, that we were actually asking for their opinions and their input and listening to them. So it was a very good relationship that formed a very good product. They were very open and honest with how they felt. And with the suicide prevention messaging in the PSAs, and we'll get to that in a few slides, the PSAs that were produced featured young people. So some young people actually created the videos that were on the website, the landing page, and one was professionally produced, but it incorporated youth stating the suicide prevention message.
Great, thanks. So feel free to type any other questions you have into the Q&A box.
Jeff, I love that question, and I love the answer that Jane gave. And I think again, these are all examples of how nuanced having this formative research really starts to help you make design decisions, because otherwise we wouldn't know the answer to that. We wouldn't know, will they be put off by quote unquote old people talking to them. So that's really the specificity that we can get to when we have formative research. Okay, we're going to continue. Go ahead and continue as we go to. We're going to have lots of time at the end for Q&A too, so we'll forge on ahead but type your questions at any time. So as always, there are challenges, and so we're going to talk about a couple challenges. I'm going to invite Jane to talk about a few challenges she faced, and we don't have any slides for either of these, but she's just going to kind of tell you how these came up. So the first challenge is, and actually this is a sort of a version of what Anara told us at the beginning about a challenge, where she talked about there was a resource created by a state agency, and the kind of advocates in the community wanted to just dismiss the whole thing because of the word commit, because they didn't like that language. So a lot of times we are in a position of working with partners who don't know about safety or have different views on what's safe or acceptable language. And so, Jane, how did that come up in your project?
Well, we had wanted to have a professionally produced public service announcement to broadcast during specific television shows that had a high youth viewership. So we had gone to a television station and talked to them about suicide prevention and our goal in trying to elicit help-seeking behavior. And during that conversation and exchange, we shared the guidelines for safe messaging, which most people are very well aware of reporting in the media. When the television creative team came back to us, they brought a concept to us before they filmed for approval. And that was our policy was that they had to come up with a creative, and then we had to approve it before filming. Unfortunately, the creative that they made had imaging in it that we felt stereotyped mental illness, in that we felt that it put a negative light and kind of a sense of fear on individuals who have mental illness. So it was a bit of a delicate conversation to explain our concerns about that imaging and ask them if they could modify the imaging, and had a couple suggestions how that could be done, but maintain the integrity of their creative concept. Unbeknownst to us, they went back to the studio and did a complete 180 and came up with a second concept in which they used a diverse group of youth, and it was a very upbeat, fast-paced public service announcement with an energetic music tempo behind it. And the youth were naming the signs and symptoms of suicide, indicating that knowing them could help them save a friend, a family member, or themselves from suicide. Ironically, that second concept, PSA, was recognized by the Southeast chapter of the National Academy of Television Arts and Sciences and was nominated for an Emmy in the PSA category. So it was very exciting for the studio to have had created something on a topic that was so sensitive, but was received, with great interest and great support from the Arts and Science Academy.
Yeah, I think that's great. I love how that story sort of has such a happy ending around, that, it was maybe an awkward conversation to have, at some point, but then, they really got re-energized and just took a whole different approach in a way that was incredibly positive for the message itself. So those of you who might have grappled with these kinds of issues or are grappling with them, persist, have heart. It can work out. So the second challenge is working within state government, or really any bureaucracy. But when you work within an agency that's got specific rules about how you do specific things, I think that can also be a challenge that people face in communication. So Jane, can you talk about that in your project?
Yes, as I alluded to earlier, although our youth focus groups indicated that social media was one preferred means of communication, and we personally thought as the Suicide Prevention Program team that Facebook would be a good means to engage the youth, state policy and procedure did not exist for social media at the time. And only today it's being used in kind of trials with engaging professionals to the agency rather than youth to the agency. When we were developing the concept for the website, the policy that existed stipulated that the format, the look of the website, needed to adhere to the state agency template, which is very text-heavy, has a certain color scheme, certain font style, certain layout. But fortunately, individuals in the Public Affairs Office pointed out that there was a policy called a branding exemption, which existed, and that we could basically present that we wanted to reach a specific target audience with a specific message, a subject that was very focused in nature. And because we could demonstrate that by pulling out our notes from the focus groups and showing them the feedback of what resonated with the youth, that this was a very specific message for a very specific audience, we were granted the branding exemption for the state and was able to have the website look the way it does, as you saw in previous slides. I think the take-home message from it is that when you're developing a message, whatever means that you're going to use, to be assured of that your state or agency's policies and procedures are in place that support the product that you're trying to develop, so that you don't spend time or resources that will end up being lost.
Great, thank you. So now you all know that there's a such thing as a branding exemption, and if your state doesn't have that, you can always say, well, geez, North Carolina has a branding exemption. Do we have anything like that? So puts it on the table for you, perhaps. So I think that's also a great story. And I know a lot of this took time, and maybe more time than you thought it might take at the beginning, Jane, but, so you persisted and prevailed. So then another issue that is important to communications is making sure that your audience sees the messages and has enough exposure to it that it kind of has a chance to sink in and make a difference. And so one aspect of that is often putting it out through multiple channels, through multiple, getting it out there in multiple ways. And that's one reason to kind of be looking at your efforts as a whole, because instead of having kind of different overall messages coming out through different channels, having more coherence across your messaging efforts also helps with the exposure issue. And then we want it to reach the audience multiple times. So this also goes back to the earlier question of what's the trade-off in trying to reach everybody versus a more targeted audience. If you're trying to reach a more targeted audience, then you can focus your resources on exposure to that audience. So Jane, why don't you talk about how you handled this issue?
Okay. Well, our promotion took different forms, and I typically call it traditional methods and non-traditional methods. Traditional methods were more targeted at adults, the individuals we trained, or adults that we would interface with during awareness events or other types of activities, exhibits at conferences. And those traditional methods are kind of the hard copy materials like the brochures and fact sheets that adults seem to request and want to be able to take home and take back and show their colleagues. With the non-traditional, with the media and using the student-produced, student-oriented PSAs, we went through cable television on popular shows that had a youth viewership, as well as we got into theaters that would be showing a movie targeted at a youth audience, and the PSAs would run as a preview to that particular movie. We also listened to the youth about promotional items that they'd like. So we came up with things like pictured wristbands and jump drives and the T-shirts, and used those as giveaways at events where we knew that there was going to be a high percentage of youth. So certain runs that were put on by schools, as well as school assemblies, we took those items and packaged them up as kind of giveaway raffles during those presentations and events. And we kept true to the feedback from our youth focus groups in that there is a section on the website where you can enter your name in to win one of the T-shirts. The T-shirts are very, very popular. In fact, the logo has gained so much popularity that many times our Garrett Lee Smith program is simply referred to as "It's okay to ask about suicide." They seem to not encompass that it involves gatekeeper training as well as other activities, but they focus specifically on that message. As I mentioned, we actually did have a video contest as to populate the homepage, the landing page of the website. And so those initial videos that are linked off the website also had 30-second PSA versions that were shown in selected movie theaters and on cable television. And how we approached that video contest is that we solicited concepts for suicide prevention videos from schools in those counties where we had already conducted gatekeeper training. Again, sliding in that safety factor. We provided them with the guidelines for safe messaging adapted to film and video, along with the technical specs that they would need, and stipulated that a staff person at the school needed to oversee the project. So once the students and with the staff supervisor created a concept, the concept was then reviewed by our suicide prevention program team, and if it met with our approval and our interpretation of safe messaging, then we provided the students the go-ahead to begin filming. And then when the film came back, we again reviewed it. And there was one particular case where we had to have our editor tweak it a little bit because it was a note that had some was more of a suicide note, and we had it kind of cut out, and the note became therefore somewhat ambiguous as to whether or not someone had given the individual the note or a person had written something themselves. So it became, a non-issue that an exchange of a note went back and forth between these actors in this video.
Great. So I think those are great examples of kind of how to have the involvement of people in the community, but also to kind of frame that involvement so that it's safe and it's useful. And so, I know some other people who've done similar contests have gone even further in terms of guidelines and saying, here are the themes that we want you to hit on, or, to given some content guidelines in order to keep it coherent with their certain objectives or certain calls to action. So, but I think that idea of having somebody who's sort of supervising it at the other end and then those multiple review processes is really critical. So you want to be inviting and inclusive, but you don't want to be in a position to have to say, after something's already completed, oh, we can't use that. So these are great mechanisms to, to build in those reviews as you go along. So thank you for that. So we know that planning isn't just a one-time thing, that it really should be iterative, and that you might go through different phases of the same messaging efforts, or you might, change them up as, so that they stay fresh as you go along. And so, Jane, why don't you talk about some of the evolutions of this into more recent times?
Well, we had decided to form a youth advisory council. These consisted of high school students, and we sent applications or tried to solicit applications from school counselors, again, another safety net, that, resting that the school counselors would be contacting youth that they felt were in a position to sit on an advisory council on a subject such as suicide. We were overwhelmed that we received over 160 applications from across the state to review. And it was a very interesting, time-consuming process to select only 10 students out of that group. So in the Youth Advisory Council, we had the first one in 2012 to 2013. We not only provided them with suicide prevention information on various topic areas, but we also solicited their feedback on program direction. And what you're seeing on the screen are actual screenshots of a public service announcement that they produced at a local television station. And to try to provide an authenticity to the prevention message, we extracted statements and phrases that the youth used in their application. So they're actually saying their own words during the PSA. In the following year, we went through the same process where we selected 10 high school youth to teach them and also provide them with suicide prevention training. This particular council then actively was taking the message back to their schools and advocating for suicide prevention programs, including GSAs, or gay-straight alliances. So these particular youth became the message agents. So the messengers became the message. So when they went back to their community, they were interfacing with their school officials as well as with their peers. And we hope in the future that we'll be able to utilize them to develop messages for special populations, since they are a very diverse group. They're from urban, rural settings. Their family compositions are different. There's some blended families. They're racially diverse, as well as they're included are suicide survivors, attempt survivors, those in recovery, and self-identified LGBT. So we have that diversity that has a finger on the pulse of what might resonate with those who are similar to them regarding suicide prevention messages. And with the two youth advisory councils that we had, they took sharing the message with their communities back in their home counties within the state, but they took it further. They took it up to the national level, and 6 of our members are currently serving on the American Association of Suicidology's Youth Advisory Board.
Yeah, so I think that's just an amazing example of kind of, that probably couldn't have been the first year of the communications effort because the youth weren't trained enough. But, as time went on, they became kind of, a critical part of the communications campaign itself, and also are helping to shape the message. So that kind of cycles back to how your grant program has evolved, where you're targeting some more specific populations, and that dovetails with the interests of the Youth Advisory Council to do some more targeted messaging as well. So I think that's a great example of something that seems like might have seemed like a program structure and then also became part of the actual campaign.
Yes.
So we're going to have Q&A right now, so while you're typing in any questions that you might have for Jane or I'm going to give you just a quick little tour of the suicide prevention messaging website. So go ahead and type into the box at the bottom, and then we'll also do this little tour here. So you can't see this, but this is the home page. Just again, note the short URL, suicidepreventionmessaging.org, is the one that you should share. So there's a slider on that home page that kind of cycles through a real brief definition of what each of the 4 components are, has what it's about, why it's important, how it's unique, and then some links to other parts of the site. And this, just highlight the global navigation, because I'm going to blow that up in the next slide. So just making that larger, what is the framework section? That's where you'll find the background research and a lot of detail on the results from the research results that I presented in the first part of this webinar, and then also kind of who was involved and lots of other information about kind of the background of it. There's 4 sections of the website, one for each of the 4 framework elements, and then there's a section for illustrative examples. So if you click on any of the framework elements, you see this submenu. So there's a submenu, and that menu appears along on the left side there, like you see. And the arrows that are pointing that out, for strategy, safety, and positive narrative, guidelines is a little bit different because it's just more of a clicking you over to a menu. But there's an overview of the component, tips section, how it fits into the framework, and resources for that element. So that's what you'll find in the subsections. And then for each of the subsections, there's 1 or 2 specific sections that are specific to that component of the framework. So the 2 strategy-specific sections, you won't be surprised to learn, are the principles and the key planning steps that I showed earlier. So that's kind of the basic structure of each of the pages. The illustrative examples click over to that page. I want to just emphasize that these are not considered sort of right messaging just because of everything we've talked about in terms of context. So it depends on your, kind of the focus of your efforts over your programmatic efforts, which audiences you're trying to reach. So we don't want to really discourage just looking at other people's messaging and picking that off the shelf for yourself without thinking about, well, what were they trying to accomplish and who were they trying to reach? And for the most part, we don't have a lot of evaluation data on campaigns, so we want to also, these aren't considered effective. what the purpose of these is to illustrate the framework components, to show you, to kind of bring to life what it looks like to be strategic and to be safe and to convey a positive narrative and to follow guidelines. So if you click over to that page, there's a menu of them. There's kind of a headline, a brief description of what it is, some sort of tags that are the keywords that go with that. And then to expand that into, if you're interested in reading any given example, you can click either of these, and I'm not going to show you the expanded version here, but that's how you look at the longer description. So you can scan through the examples and see which are of interest to you. And then Anara mentioned earlier that there's a way to sign on. So at the top of every page, we have the Your Message Matters, sign on and take action. And it's really our call to action around the framework to encourage you to just kind of make a commitment to say, I'm interested in messaging in a way that's strategic and safe and conveys a positive narrative and follows guidelines. And then we give you a whole set of examples around how you can take action to share the framework and to use it. So please do that. And you can look at the home page. Actually, I didn't linger on that, but the home page has a scroll that shows who has already signed on. So yeah, I encourage you to have a look at that. And we will take questions now.
Great. Thanks, Linda. So we have one question from Jeff. He was thinking back to his marketing class days in college and conversations about trendsetters, students who are trendsetters, and how some companies used to pay kids to wear or do things in order to get messages or branding out there. So he wonders if there's something that we could do similar to that with suicide prevention. Could we engage the cool kids, so to speak, or the trendsetters to help get our messages out there to make suicide prevention cool?
This is Linda. I'll jump in here, and then Jane, if you have anything else to say, you're welcome to. I think we should be thinking along all of those tools that marketing use. And I guess the sort of question that occurs to me when I hear that your question is, are the cool kids the right people to get the training? So let's say, and it depends on what we're training them for, but there is some good literature on natural helpers, that there are people, that some of these are around adults being natural helpers for youth, but I think there's youth that are also the people that other youth talk to. And they've done this on college campuses where they've gone to youth and said, well, who are your peers that you kind of would go to with a problem, or that you would trust, or that you think people can confide in? And then reached out to those people as natural helpers to get the training. And so my question would be, are the cool kids the natural helpers? Because we don't necessarily want to put people in a position of getting trained for a role that they're not kind of that suited for. That said, there might be a way that if we have that cadre of trained adults and trained students, that we might be able to also identify the cool kids and enlist their help in kind of spreading the brand. So I think that that's a great idea. And but Jane, you did work with youth, and so I wonder what you think about the cool kids versus some other categorization.
Well, we were fortunate in that our Youth Advisory Council members, many of them were already involved in other activities at school, which gave them exposure to the student body. So they were all already, in certain sense, leaders in other areas. And even though, they were suicide survivors, which made them passionate about the topic, it also energized them to do other works to be supportive in the community. And we did have a situation. She was not a member of the Youth Advisory Council, but she had contacted me because she saw the site. And she's actually a pageant contestant, a teenage pageant contestant, and formed her platform for her pageant on suicide prevention. So through her exposure to, kids through, the pageant circuit, she's promoting suicide prevention. And I would think that would be kind of a cool kid category.
Yeah, that's fantastic. Yeah, Jeff follows up saying the cool kids might not be the natural helpers, but they are the billboard of kids. And I think that's what I was trying to say around, I might not train them if we don't think that they're the right people to get the training to be peer supporters. But once we have other trained people, I think that, getting them to wear the T-shirt, and I'd probably try to give them 2 sentences that if people say, what's that T-shirt about, that they know what to answer, that it's about, and hey, go check out the website or whatever. But I'm in agreement with you exactly that we have to think about, if is there a strategic way and a safe way and a kind of sensible way to use all the kids in the social ecology and the ways that the strengths that they bring. Any other questions or comments from anybody else at home? And I will, while I'm seeing if there's other questions, I'll just also make a comment. One question that comes up a lot around this is putting data and statistics first and how we use data and statistics. And I think that's been a little bit of a struggle for people, that we don't want to hide the extent of the problem, and we're not trying to minimize that in any way. But I think, from looking at a lot of messages, we have really led with that prevalence data for a really long time. And I think there is a way that can be done, especially if it doesn't have any other version of the positive narrative that kind of maybe conveys the negative narrative, maybe that there's something that can't be done about it, and that it's really that I think it can make people glaze over. You hear a big number like 39,000, or how many ever people in the world, and it's hard to get your arms around what you could do about that. So I think that I know Anara's on the webinar but can't speak, so I'll say that one thing I know Anara has done is sort of move the statistical information, if she's going to convey any at all, to the middle of a presentation. So I think one thing we can do is have it, but we don't maybe have to have it on the homepage. We can have it available for people who want it, but how do we lead with those calls to action and the something that can be done, the kind of self-efficacy message, and make sure that it's kind of supported by data, but that we're not just trying to drown people in those statistics. So I think it's really not a yes or no on statistics. It's really just thinking about them in a more nuanced way. I've also seen people talk about the statistics in terms of the solutions. So by funding our crisis centers fully, we can help to address the estimated 400 million years in costs from suicide. So I think that's another way to do it, is to use have a positive narrative and have the statistics coupled with that. So I'm going to turn it over to Carrie to just wrap us up. Thank you so much all for participating.
Great, yes, and thank you, Linda and Jane. This was really informative and really interesting. So I see another question, and that was actually just what I was going to get to. So this webinar has been recorded, and we will post it on SPRC's website. We also will send an announcement out on the state planners listserv that you guys got the invitation for this webinar on once those materials have been posted, because Jane also generously shared some resources from her work that we'll also post with the webinar. We will also be sending you an evaluation of today's webinar, so look out for an email from our external evaluator, SSRE, sometime soon, because we really value your opinions on our webinars and how we can make them more beneficial for you. Also, if you have any additional questions, here's some additional resources that you can look into, the framework and the Action Alliance, as well as SPRC, if you'd like to find out more. We've also included our contact information here, but I also wanted to remind you all that if you are a state coordinator or a GLS grantee, you all have an SPRC prevention specialist who you can contact with any questions you have about your communications campaigns, and they can also provide consultation and resources. So if you don't know who your PS is, feel free to email me at ksmith@edc.org, and I can connect you. And I just wanted to thank you all again for attending. And with that, we'll sign off.